Hi, welcome back to my channel. Right now I'm sitting with Dr. Jose who's come down from US, and he told me he will tell me the technique how you can make a lot of money the easy way very fast. Is that right, doctor?
Drive and thrive. And our guest today is
Sorry, Mr. Paul, but there's not such a thing. Making money require entrepreneurship, require effort, require inventive, require hard work, and require a good team.
Yeah, I take my words back. So let me introduce you. We are here with Dr. Jose Lopez, who's flown down from US. He has an amazing entrepreneurial journey. We will talk about it in this video, and how he has transitioned from opening multiple clinics in US and now he's doing the same in Dubai, and we'll talk all about it in this video, so stay hooked on. Doctor, I do understand that you come from Venezuela and it must have been hard. What compelled you to move from Venezuela to US and start business there?
Well, I was ready for a new challenge. I was ready to leave my comfort zone. That was my decision more than 20 years ago.
Okay. And you had studied medicine in Venezuela?
Yes, I did. I completed my medical education in Caracas, Venezuela.
Okay. And then when you went back to US, I'm sure you had to appear in their boards, and how was the journey like there?
Absolutely. I had to validate my title, take the ECF&G test examination.
Yeah.
And then enter into the formal training for internal medicine.
It was like studying all over again for you?
Well, it was condensated. It was intense work for 2-3 years time.
Right. So then you become board certified.
Then I entered into the internal medicine and training board, and after 3 years, I completed the training and I took my internal medicine board, and I was certified. Yes.
Yeah. Because here, generally, everyone looks up to board certified doctors, and you are an internal medicine specialist. Am I right?
Yes, absolutely correct. Board certified by the United States Internal Medicine Board.
Do tell me, like, everyone looks up to the American medical system, and how was your journey while you were working in America, and what led you to start your own clinics there? Like, you started your clinic there immediately after you finish your board?
No, actually, I worked for doctors, and 3 different doctors, in fact. I worked for medical facilities. And then about 20 years ago, I have decided to go by myself, open my own practice just with me.
Right. And you were married, if I may ask, when you shifted from Venezuela to US, were you married or?
Oh yeah, absolutely. I met my lovely wife back in the medical school, indeed in Caracas.
Fantastic.
And we basically shared the journey.
Right. Because it's very fascinating for so many people to hear stories that you transition from one continent, literally from South America to United States, and since I know you made it big there as well, what it requires to take such steps to transition into a new life?
Well, basically, the first reason is the curiosity and to leave the comfort zone and to be ready to have new challenges in professionally and your personal life.
So the challenge and the curiosity to start in a new country all over again. So what were the initial challenges you saw when you moved to US?
Well, the first of all will be language.
Okay.
Then it was basically review part of my medical school that already passed for years. It had to be reviewed, and basically there were part that they were not even reviewed in deep as I had to do it in the United States.
We discussed, you already went through all those exams, And you opened your first clinic where in US?
Always been in Florida, in the Orlando area, and then we have decided to move a little bit from that first location north and south, and try to be more available for our patients.
Right. Like you own couple of centers there, isn't it?
Three
Three clinics.
clinics.
And what are we doing there exactly?
Basically, I'm trying to be as complete and as global to the patient as I can be. I can be I feel that I have responsibility as a health resource, as a health center and orientation for the patient.
So all three centers are mostly
With the same philosophy, yes.
okay. So they are into well-being.
From the common issues like alcohol
Okay.
to the more complex issues, emotionally, physically, well-being, wellness, nutrition.
Doctor, I was excited when you were telling me about hormonal therapy. You're doing therapies like hormone therapies, and you've seen like fantastic results in them in men and women. Tell me more about that.
Yes, indeed. For the last 3 years, I've done hormonal replacement therapy for men and women,
Okay.
and there were many issues or complaints or medical issues that we're facing before that. Myself as an internist, I wasn't able to manage until I found this resource, and beyond the sexual part is a part of our life, from memory to energy to capacity for work. It all comes together.
Right. So you were successful. You're seeing like good results.
Absolutely. My daily experience is family of women, friends, even both components of the couple will require, as soon as one member have hormones, the other member will require or will request, because of such of improvement of symptoms. Like otherwise you have to treat it with multiple medications, multiple therapies to fairly have an answer.
Anything else like you think you've seen amazing results with?
Well, I think this is the time that we can gain health ages, because it makes you younger.
Yeah.
And make you feel younger, and indeed being younger.
Right.
Weight loss, hormonal
And you
therapy.
promised me you're gonna put my belly in check. Yeah.
Absolutely,
You
that's
get me in check.
that's an easy and safely way of doing it.
Right.
And we have tons of experience. For the last 15 years, I have used GLP-1 therapy, among others, to assist the people with weight control.
You come with a lot of experience when it comes to overall health, obesity, getting in shape,
Absolutely.
and also managing my hormones, isn't it?
Absolutely.
Yeah.
I can tell you that my experience go back 15 years ago.
Okay.
Even with the media has not exposed the use of GLP-1 as a way of treating overweight.
I know today, like, we've been together in this journey of you setting up a new clinic in Dubai, and you flew down almost 14 hours flight, was it?
15 hours
Flight.
for a one
Right.
leg flight. Yes.
And is it your first visit to Dubai?
No, absolutely not. I've been several times on here. I find in love with the concept of the city, the opportunities of here, the growing.
You like Dubai?
I love Dubai.
And what excited you about the city? The way, like, you came here as a tourist first?
I came probably about 5 years ago, initially for a short period of time as a tourist with the family, and I have come several times, even with my wife. We like the vibe of the city. We like the growing of the population. We like the opportunities of implement new ideas, new concepts.
Actually, Dubai is a very cosmopolitan city. You will meet people from all over the globe. And one of the biggest reasons people love Dubai is because it's multicultural, it's one thing. Second thing, it's very, very safe. And third is the taxes. So people or most of the doctors I know here, they're very happy because it's only the VAT or the corporate tax which you pay, and with all the hard work you're doing, you literally save all the money of what you're doing. So that's one of the reasons I have seen a lot of people coming here from different parts of the world. As we were talking, I do understand you have a very, very busy practice back in US and you want to set up a couple of centers here. It's a new place. Definitely Dubai is very welcoming for investors, for doctors from all over the globe. But what's your plan for Dubai? How you can manage two places, sitting in US and working here? What's the plan like?
Well, I will tell you, Mr. Paul, that I have this idea of facilitate the interaction between physician and patients. And one of those will be telehealth. And basically, that will allow to have an interaction regardless of location of both parts. And that will be in accordance, with the busy lives that everybody has nowadays.
Fantastic. So you want to set up a telehealth center here?
Part of the concept will be a telehealth, but will be expand to other areas and also have a physical interactions with the patient.
So when we say telehealth, means that you will have some consultation sitting in US and you can diagnose the thing sitting from there.
It can be done in any way. Absolutely, it can be. I can speak with a patient anywhere in the world. Okay, and I can have an assessment of many medical conditions via telehealth.
Right. Yeah, I think that would be a very good way to handle both places, that you can be here and sometimes you can treat your patient sitting from US. And you be rest assured, we can get you all approvals to do so. But before I talk about myself, I want to also know your experience. Like when I think you were telling me a story that someone was helping you and it didn't work, and finally we connected. So I would love that you tell our audience more about this as well.
Yeah, basically, it's not only about the desire, the desire of implementing new ideas. Important aspect of the equation is somebody who assists you and somebody will that partner with you in order to achieve the goal that you're looking in a reasonable period of time, in an effective manner, because we're taking time off from our daily life and work.
Yeah. And how's your experience been with us as of now?
I can tell you for the week that I have done here, and it absolutely has been one of the most productive weeks that I ever had on my life. I had not imagined to do as much as I did in the last 4 days.
Thank you, doctor. And I must tell you that doctor is a very, very busy doctor back in US, and he gave us 1 week that he will be here to set up and get the basic documentation done for his clinic. And yeah, it's 4 days he's been here, and as he said, we have achieved a lot because we really value his time and effort he's made to fly down, and moreover the trust he's shown in us, and that's most important for us. Doctor has a vision to set up a nice clinic here, offer latest what America has to offer, bring it here and offer to the patients here. And I would like you to tell us more what all you want to offer here, so that people look forward for you starting your clinic here.
I want to treat the patient the same thing that I'm treating my patient in the United States, where I bring, a trusted medical opinion with the latest and the safest way to deal with health issues.
And what are the top 3 treatments to go for in your clinic when you open it in Dubai?
telehealth will be part of those, will be an important part of the aspect because, again, I put myself on the shoes of the patient and how busy we are. Number two, it will be well-being. And number three, it will be a good relation between doctors and patients.
Amazing. So that's a real doctor talking, who's running successful clinic back in US, and I'm sure he will be having a far more successful clinic in Dubai as well, because he's not making any overcommitments or extra promises. Thank you, Dr. Jose, for joining me in this drive, and I'm sure a lot of doctors would be inspired to move to Dubai looking at you and taking the challenges and, as you said, getting out of the comfort zone to build something new.
Thank you, Mr. Paul, and to the Spectronic teams for the amazing resource that have become for myself, and I'm pretty sure that will be also helpful for anybody who wants to take the same journey that I'm doing.
Thank you, doctor. And stay tuned because we will keep you posted as his new clinic comes up in Dubai. Thank you.